Hi, my name is Jenna Medved. Did you know that in 2024, nearly 3 million people were diagnosed with breast cancer? I myself am in my late 30s and have had 3 people in my life that have been diagnosed with breast cancer. Chances are high that you will know someone affected by this disease at some point in your life. That's why I'm here to talk to you about the effects of radiation on breast cancer, the subsequent effects on your skin, and how to manage your symptoms. Knowing this information could help you or someone you know in the future. So let's get into it. Once diagnosed, breast cancer is typically first treated with a surgical procedure consisting of either a lumpectomy or a mastectomy to get rid of the mass. In a lot of cases, radiation treatment is then used to ensure the tumor is eradicated. Dr. Wakar Hack is a radiation oncologist in Texas. He did some research and found that 98% of patients who received radiation therapy, combined with the estrogen suppression hormone therapy of tamoxifen, following their initial surgical treatment, did not have recurrence of a tumor, as opposed to 90% who just used tamoxifen alone. This shows an increased positive correlation with radiation and disease outcomes. There have been new advances in the ways we use radiation to treat breast cancer, especially for radioresistant breast cancer. Radioresistant breast cancer is just as it sounds, a tumor that is resistant to radiation treatment. Dr. Yun-Suk Kwon holds a postdoctoral position at Dongguk University, and one of his research specialty areas is cancer cell biology. He performed a study on mice that were infected with radioresistant breast cancer and found the differences in cancer radioresistance between conventional radiation therapy and hypofractionation radiation therapy. 2 ways to administer radiation that I'm going to speak about today are just those: conventional radiation therapy and hypofractionation radiation therapy. For both of these, the gray is the unit of measurement for the dose of radiation given to the patient. He gave conventional radiation therapy, which was 2 gray, 5 times, or hypofractionation radiation therapy, which is 7 gray, 1 time. He found that in radioresistant mice, the hypofractionation therapy dose was more effective at killing the cancer cells than conventional radiation. Now, the great news is that we have treatments out there that can get rid of these cancer cells in our bodies. But one of the side effects of radiation therapy is radiation dermatitis. Radiation dermatitis is inflammation and irritation of the skin following radiation treatment. There are 3 grades of radiation dermatitis, with 1 being the more mild form and consisting of redness with dry, flaky skin, and grade 3 being more severe, with symptoms such as open sores, severe swelling, an inflamed rash, and possibly even bleeding. Shiny Evangeline Imbaraj, a pharmacist researcher, led a study with other scientists in the field of radiology oncology. Together, they did a study that correlated dermatological counseling with more pleasant outcomes for patients following radiation treatment. Patients who were given counseling on ways to effectively manage their symptoms post-radiation were more comfortable, as they were better able to manage their symptoms of radiation dermatitis. Some techniques that can help manage symptoms are using lukewarm water and mild soap when bathing, wearing loose-fitting cotton clothes, avoiding the use of heating pads, avoiding the use of ice packs, and having soft bed sheets. So there you have it. Those were the effects of radiation on breast cancer, on your skin following treatment, and ways that you can help manage your symptoms. I hope that this information was helpful to you. Thank you for listening.